Is her sleepiness because of the valve? Is it mitral?
Mitral, yeah.
Mitral?
No, I don't think so. I think that'll be a very, I don't know if the right word is, very simplistic explanation to tell you, oh, it's because of that. I don't think so. I mean, there are a lot of people who have mitral stenosis who don't feel sleepy, you know what I'm saying?
Okay.
It's not, there's multiple things going on. I don't think it's that, I don't know, what am I doing here? It's, finishing count, I see. Mrs. Slater is a 75-year-old female who is evaluated in the hospital 10/17/2020. For details, please see consultation from that date. Period. She has a history of hypertension, hyperlipidemia, diabetes mellitus, no prior history of stroke by history that is available from her daughter, prior history of pancreatic cancer for which she had partial pancreatectomy performed in Syracuse, New York. Period. Briefly, period. Scratch that. It's very slow, something is not right. Okay. She was on amiodarone when she was seen in the hospital. There was some concern as to whether she had atrial fibrillation in the past. After a rather long conversation with her daughter, it was decided that she would follow up with Dr. Krishnasamy, and if she was felt to be a candidate that could have the consideration of underlying surgery, then we would perform further testing from a heart standpoint. This is especially the case in light of her underlying lung disease, and I'm informed by the patient's daughter who's here with her today that it is felt that she's not a candidate for any kind of surgical intervention, period. Period. Briefly, we could treat her conservatively. She has a mean gradient of 12 to 13 millimeters across the mitral valve, and the mitral valve area is in the severe range of at least 1.5 centimeters squared. Period. She does have a history of pulmonary hypertension.
Mhm.
Are you using oxygen at home?
Yes.
And she's on home oxygen, period.
Sometimes we have to bring her portable with us.
Okay. Echocardiogram. She has normal LV systolic function on an echocardiogram performed in the hospital, 10/20, period. EKG performed today demonstrates sinus rhythm with intraventricular conduction delay, left axis deviation, / atypical left bundle branch block, period. Okay, so see how it goes. I wish I could be more encouraging, but I don't know what else to tell you, something.
What, okay, with what she's got going on right now, what is the future looking like?
Okay, so basically, let me tell you what the story is here. So, So, in March of this year, she had an ultrasound done of her heart, okay?
Mhm.
And that showed that the mean gradient was like 4 millimeters of mercury, okay? The subsequent echocardiogram shows that the gradient has gone up from 4 to almost 12 millimeters of mercury, 13 millimeters of mercury, okay? So what we need to do is, I would repeat an ultrasound, maybe in a couple of months,
Okay,
and see what the numbers show,
okay,
and then go from
okay.
there. Does that make sense?
Yes. Now, as time progresses with this,
Yeah.
what do I need to be looking for at home?
Prior to this, she had an echocardiogram performed March of 2020 with a mean gradient across the mitral valve approximately 4 millimeters of mercury. It is unlikely that the mean gradient, if it was 4 millimeters of mercury, has suddenly increased to 12 to 13 millimeters of mercury in 6-month period. We will repeat an echocardiogram in the next few months, possibly in 5 to 6 months, and follow up on the same. Okay? So that's the issue. So see how it is, ma'am. Because what should you expect? They will repeat ultrasound, see what there is. There's more fluid, they can tap it.
Okay.
Okay, the other option is to do all kinds of invasive testing. You have to go through a groin, inject dye into a heart, find out what it is, measure pressures on the right side, on the left side. It's pretty complicated, but can be done. No big deal.
Okay.
And you measure pressure, see what it is. The question is, what do we do after that?
Mhm.
If the answer is, well, she's not a candidate for surgery, like we discussed, then why put her through all that?
Yeah.
The simplest thing to do is to do an ultrasound, regular echocardiogram. It was done, this was most recently done in October. November, December, January, February, March, April, you can repeat ultrasound.
Okay.
See what it is.
All right. And will somebody call me?
Yeah, we'll give you a request for that.
Okay.
Yeah, go from there. Take a deep breath.
Deep breath.
Let it out. Deep breath. Deep breath. Let it out. Deep breath. Out. Deep breath. Let it out. Yeah. Deep breath. Out. Let it out. Deep breath. Out. Yeah, she is developing fluid a little bit over here.
Yeah.
The lung. Whenever Dr. Swami gets X-rays, he can look at it, see what it is,
Yeah. He's got orders for her to have some X-rays done.
and then see what it is and go from
Yeah. She's got an appointment coming up with Dr. Jackson, so we'll be able to do that.
there. Stop breathing. Stop breathing. Okay. Come, sit up. That's fine, let us sit here. You can go out in one shot.
You can sit here.
Because we're getting up, sitting down, you know.
Yeah.
Any questions, ma'am?
Well, since we can't do the surgery, and as time goes on, and let's